So my name is Julianne Armijo. I'm currently a PhD candidate. However, I'm also a nurse practitioner, and I spent 12 years working at the bedside as a registered nurse, mostly in cardiothoracic critical care. My research currently centers on workers diagnosed with bipolar disorder, with a special subfocus on nurses diagnosed with bipolar disorder, and the relationship between sleep and quality of life. So personally, my journey really started at 12 with depression. And I actually went and I visited my parents recently, and I found journals kind of detailing my feelings at the time, many of which were, I feel so depressed, but I don't know why. And I'm grateful for my life, which is good. So I just don't understand what's happening. And this, kind of waxed and waned, but then really worsened at age 16, so much that I became suicidal. And I, I sought help from my parents before anything tragic could happen. So from there, I ended up getting referred. A lot of these details are really kind of fuzzy going into the past, but um, I remember vividly that I was started on paroxetine, which is an SSRI, and that sent me straight into like this really profound psychosis. And SSRIs didn't work. Basically, they put me on a different SSRI, which didn't send me into like a psychosis to say, but it ended up just not really working. I felt very flat, and it wasn't, after giving it a good college try, it just wasn't right. So I spent most of my teens until my mid 20s very depressed and intermittently suicidal. And then things started to change as I started to notice what I reflected back on as more hypomanic type symptoms. And that progressed until my 30s, where I finally had my first big manic episodes, and I was finally diagnosed with bipolar disorder. I started off with bipolar disorder type 2 when I just kind of had these hypomanic episodes, which converted to bipolar disorder type 1. Was just properly diagnosed, I should say. So I went through a bunch of medication trial and error, and titrations. And again, I ended up going on bupropion, which inspired a very big psychotic episode that landed me in the hospital. And then finally, after more trial and error and another visit to the hospital, my treatment regimen finally rested on lamotrigine and then some risperidone, an antipsychotic. And something I discussed actually with Hannah, and related with her, was the feeling that I needed to fast during these episodes without really understanding that urge to do so. And since my early 20s, I'd been practicing intermittent fasting before there was really a whole lot of research on it. And just kind of these light bulb moments later on, just realizing that this was like my body trying to heal itself. And then further on, when I was getting my master's degree in the nurse practitioner program, I, kind of had been processing about childhood epilepsy, and that the ketogenic diet was used about 100 years ago to improve or even cure symptoms in those kids. And again, another light bulb moment was, I'm on lamotrigine, it's an anticonvulsant. I should also look into the ketogenic diet, which really started my journey, and gave insights, into that fasting, and just really just diving into that, almost, even though I'm not a physician, but that kind of mindset of physician heal thyself. So that's kind of the high level journey there, and how I ended up finding metabolic therapies in the beginning. And of course, it's been an evolution since then. Going into the ketogenic diet and not really having a whole lot of guidance that was geared towards adults or in a medical type sense, it was kind of like, stumbling through the dark a little bit and trying to do this trial and error. But once I started to get things dialed in, I noticed at first that I was a little worried. I was like, oh my gosh, am I getting hypomanic? I feel so good, and you start to get scared once you start having that recognition. And then, this was just everything stabilized out, and you just realize that you get this very this clarity after that first kind of scary moment of thinking, oh my gosh, am I going into another episode? Um, And it really, I just felt all of these very positive things, in my body, not feeling necessarily very bloated. Not that I had a whole lot with the medications I was on, but just feeling this kind of lightness of being. It's hard to describe a lightness of being in my body and in my mind, and I guess probably, it sounds kind of corny, but in my spirit as well. As far as challenges go, I think as part of that early that kind of trial and error and trying to use my background as a medical practitioner and trying to be very smart about this and using the research that was out there, and trying to incorporate stuff from epilepsy studies, and um, trying to find foods and stuff. I think in the beginning, the hard thing was I was like, oh, these keto snacks, and like net carbs and stuff, and realizing that those were kind of setting me back, but it was keeping me in just enough of like a ketosis state that I think that was actually that bupropion, that I had lowered that threshold just enough to help launch me into that kind of psychosis. I think was, it was like this perfect storm of like, this diet is actually working, but I didn't need to be on that medication anymore. I can't necessarily prove that, but I know that through anecdotal, I think that there's more research coming out now, but anecdotally from other discussions with other people, that they kind of went through the same thing, or they had to lower their medications as they started to progress with higher ketone levels. So that was a big challenge up front. And then just, kind of not losing hope and not giving up on it, because I was starting to feel those benefits and saying, I just need to really work on this and try to find the levels that work for my body, and, just try to do the best that I can. So if somebody came to me wondering, why should I try this? Why shouldn't I just take a pill? Um, I would respond with, as a provider, even when you take medications, for example, like high cholesterol, that's not a catch-all. That is an adjunct treatment to help promote a holistic state of being. So kind of moving with bipolar disorder, even with medications, people still have to make lifestyle changes to support and maintain recovery. And although personally I haven't been able to fully come off medication, changing to a keto lifestyle has allowed me to come off the medication that's associated with the most side effects and increased morbidity and mortality. Um, so I think it's just part of this. It's a holistic way to approach your whole being, because if you just take a pill, it's not addressing the root cause of what's happening. Um, and we see this in research and a lot of these longitudinal studies that are coming out, that despite having good medication adherence, people are still dying early. People still are getting diagnosed with these metabolic disorders like diabetes and the precursor of like metabolic syndrome. So this addresses a lot of those issues, along with just making you feel better.